Good afternoon, everybody. It's a wonderful Friday yet again. Welcome to the Real Talk. The road to the Regional Adolescent Health Indaba is what we continue to dwell in, and today we are excited to present a partners edition. Joining me are two amazing and powerful ladies. Yeah, who are joining us today on the show. The first one being Louis Messi Katoka, who is a prevention program assistant of FHI 360 and the youth representative. We are also joined by Laura Filedo, who is a policy advocacy and communication specialist at CSEM of the Universal Health Coverage 2030. And last but not the least, our most important person, Memory Zulu, who is a sign language interpreter. Welcome to the show, everybody.
Thank you,
Thank you so
Malungo, for
much,
this introduction.
Madongo.
Okay, I'm so excited. When I see ladies on this show, I get so happy. I think everybody who catches us live know that I'm very picky and I love having ladies on the show. So I'm very happy to have you guys here. So we're gonna dive right into it, and I'm going to jump right to you, Louis. There are so many abbreviations here. There's FHI. So I'll just love you to just enlighten us and tell us what that is and what exactly you people do under your organization.
Okay, thank you so much, Malungo, once again, and thank you for having me on today's edition of the show.
No
So,
problem.
FHI 360 stands for Family Health International, and
Oh,
we
okay.
are a global nonprofit organization. And we mobilize research, resources, as well as relationships just to ensure that people everywhere across the globe are able to access opportunities, and they're also able to live healthy lives, and they're also able to just attain their full potential. So we do have presence in over 60 countries across the world, and we implement projects such as the Mosaic Project, which I am on, and we work in collaboration with the Ministry of Health and other implementing partners, civil society organizations in sub-Saharan Africa, to help women, especially adolescent girls and young women, prevent HIV AIDS. So we're into the introduction, acceleration of new emerging biomedical products, inclusive of their uptake, their acceptance, as well as their scale up. And my role basically just involves ensuring strong program coordination and also just providing the youth length and holding the Mosaic project accountable to its planned actions, and ensuring that they are meaningfully engaging young people. Yeah, thank you.
I'm already in love with your organization. I'm already so much in love. Just you laying out what you guys do is so inspiring and it's so beautiful because we know that you are looking out for our health. And looking at the fact that you are here on the show and today we're having a partner series. So what exactly is your role in the Regional Health Indaba for this year as FHI 360?
Okay, so just to mention that we are happy to be partnering with ZYP again. We did
Yay.
participate in the third edition, and we will also be participating in the fourth edition. And for the fourth edition of the Regional Adolescent Health Indaba, as FHI 360, we plan on supporting adolescents and young people in their participation at the RAHi. So we will be supporting AYPs from Lusaka, as well as some AYPs from the other provinces. And we do have a network of young people. It comprises of 25 young people from all the provinces with diverse representation. And these are the young people that we intend to support their participation at the Regional Adolescent Health Indaba. We also plan to support one of the breakaway sessions around the HIV and AIDS thematic area, and
Okay.
as FI 360, we plan to provide technical support for this session, and
Yeah.
we'll be focusing mainly on HIV prevention and also the introduction of new biomedical HIV prevention products. As you are aware, we now have injectable carb prep in the country that was launched in February on the 9th, in one journey. And as FHI 360, we did play a key role in the introduction of CAB prep in Zambia. We have
Wow.
worked with the Ministry of Health. We did support the development of the CAB implementation plan, the development of the national PrEP and PEP guidelines, and we also just conducted some background work. We did conduct a PrEP preference study in 2021 where we assessed, knowledge as well as the PrEP preference methods amongst AGYW. So if we had the ring, if we had oral PrEP, if we had CAB PrEP, and all these other prevention methods, what is it that young people, especially AGYW, would look forward to? And
Yeah.
from the results of the PrEP preference study, we also conducted the value chain situation analysis where we assessed what exactly it takes to have CAB in the country. And from
No.
that, we're able to now support with the introduction of CAB. So people can look out to that breakout session and just learn more about HIV prevention, the available options in the country right now, and where and how CAB is being implemented, because it's not in every site. So
Yeah.
also understanding how the rollout of CAB looks like currently, and also linking them to available resources in terms of HIV prevention. Yeah, thank you.
Wow, wow. I don't know why has Ministry of Health been keeping such secrets from us, because it's not so known. Come on, guys, this is something so amazing and something that's really good for our country. Looking at the fact that we were having a little bit of difficulties when it comes to HIV and AIDS, and if your organization is coming up with such initiatives, I think it's something that we really hold dear to, and it's something amazing. So we need to follow up Ministry of Health, because this has to be on top of things.
Yeah.
Yeah, Laura, are you with us?
I am, and I'm so happy to be joining you today. I feel we're already having such an interesting and insightful conversation here. So, thank you so much for inviting me.
No, we are also so excited to actually have you here. That's the reason now I'm coming to fire you with what I want to know about about your organization as well. I know for a fact that the universal health coverage is a very important topic, and I have learned a bit about it in med school. Though don't ask me, I forgot, but I still have some knowledge. But I'll just love you to just tell us why you think it's a very important topic, especially at the RAHi 2024.
Thank you so much, and I'm glad to know that you've studied also UHC during your study. That's really really great.
Mm.
So just before, I would like to maybe also emphasize that I'm also part of RAHi Health,
Oh,
which is an African regional advocacy organization championing the end of life-threatening epidemics, and is one of the co-hosts of the Civil Society Engagement Mechanism for UHC 2030, in which I work especially on advocacy and communication. And yes, maybe I can also tell you a bit more about, universal health coverage and the basic on this. But UHC, universal health coverage, means that all people have access to quality health services they need when and where they need them without financial hardship. And well,
okay.
we are not there yet, because like more than half of the world's population still lack access to essential health services, and like more than 2 billion people still face financial hardship trying to access it.
Yeah.
So these are like alarming facts when we know that the right to health is a basic and fundamental human right. Right. So the goal of UHC is really about making access to health more accessible, more equitable, and more affordable. And
Yeah.
that's been like a main goal embedded in the Sustainable Development Goal by the UN in 2015. And this
Wow.
commitment has been renewed during the high-level meeting on UHC last year, which was focusing the last talk show I was part of. And so that's a really important subject. And I
Yeah.
think it's important for this conference because, as we know, the government alone cannot deliver UHC fully. And
Yeah.
civil society including youth, as a really important part to translate these commitments into real policies at the national level,
Yeah.
with a high focus on vulnerable and marginalized populations. So this will be the first edition that we participate as CSM for UH 2030, and I hope there will be more to follow.
Yeah, we are so excited to actually have you guys with us, and we are so excited to have you as part of the RAHi 2024. This is going to be a very amazing event. I can't wait. I hope you guys are feeling the way I'm feeling, because I really can't wait. It's going to be so amazing. So we are still on partnership. Yeah, you guys are partners. So definitely I'm going to ask you what you have for us as TYP at the RAHi 2024. So, Laura, what does your organization have in store for the adolescents here who are going to attend the RAHi 2024?
Thank you, Malungo. So yes, we have exciting plans for this year.
Okay.
Among them, we want to organize a UHC workshop as a pre-conference with youth people from across health issue areas to really learn more about UHC through different advocacy toolkit that I can also develop on, and
Yeah.
explore how they can meaningfully integrate UHC into their work to advance health for all. So we also aiming at the end of this workshop to have a statement that will be given by young people, hopefully during the plenary, because during the plenary we'll have a panel session to focusing on UHC, and that will be great if there will be high level political person, maybe Minister of Health, and it will be awesome to have young voices also
Yeah.
talking about that and stating the importance of the urgency to act now. I hope I've
No,
answered
okay.
to your question, dear.
Yeah, yeah. You actually have. And just for people's information, I hope people are really listening to what's been discussed here, because today, once you see Malungo on this screen, know that TYP has some amazing giveaways for you. And for today, TYP is giving away a TYP t-shirt and 50 kwacha airtime to certain people who answer certain questions that we ask. And definitely the questions are coming from what we are discussing right now with our beautiful ladies. So those who are keeping in check, those who are understanding, you're in for a very good giveaway. So Louis, I'm back to you. Yeah. From our conversation, I heard that you actually attended the previous RAHi, and you are also attending the next one. So I would just love you to just tell us how your experience was at the previous RAHi you were at. How was your experience? How did you enjoy the moment?
Okay, so reflecting back on last year's Rahai, I think I did have a great time, and
Yeah.
it was an opportunity for me to, interact with other young people in the space, and also
Mm-hmm.
just learn more about, what other young people are doing, and enhance my knowledge on adolescent health, because we did have a lot of young people in the room, but then we also had various stakeholders. We did have people from different organizations, implementing partners. We also had people from government. So we had government representatives, and we also had parliamentarians in the room. So it was a great opportunity to just interact, and also learn more on the interventions that
Yeah.
different organizations are putting in place to ensure that they are meeting and addressing the needs of young people in Zambia, but then also across the region, because we also had young people from other countries as well. So it was a great opportunity to just network, to learn, to enhance knowledge. And I did have an opportunity to contribute to the development of the position paper, which was
Yeah.
great as well. It was a very great opportunity for me to just ensure that the voices of young people, especially the young people that I work with, the young people that I represent, since I'm a youth representative under the Mosaic Projects. So ensuring that their voices, their needs are reflected in that position paper was like a huge thing for me. And I look forward to still learning and still enhancing my knowledge and networking with more people at this
Yeah.
edition of the RAHi. And just to mention, last year we did have an exhibition booth where we interacted with young people. Yes, we interacted with young people who came to our booth, and we also shared some available resources that we have under Mosaic Project. So that's also another thing that young people can look out for the fourth edition, because we're going to have an exhibition booth as well, and young
Yeah.
people can just visit us, ask us questions, get to learn more about opportunities that exist within this space, but then also within the Mosaic Project and FHI 360, and how young people can be meaningfully engaged and meaningfully contribute to addressing health needs and health issues that we
Yeah.
as young people face. Yeah, thank you.
It's really amazing how we are able to inspire people using your past experience. It's like there's so much positivity that comes out from the RAHi, because based on what you've said, networking, interaction, it's like so much was learned, and people just hearing that is amazing, because now people are happy. If you could experience that, they could also want to experience it. So I just love how you had an amazing experience. So right about now we are going to dive into some comments. I can see we have so many people who just want to speak out and just keep commenting as this conversation keeps going. So our first comment is going to come from Kababu Mukonda. Today we only have ladies. Of course, Kababu. And you know how excited Malungo gets when she sees ladies. I'm so happy. We just have ladies today. Another one comes from Gloria Nduku. Good stuff. Yes, we are as excited as you are, Malungo. I love to hear this. The other one is coming from Miss Nelly Lopez. Truly, it's going to be amazing. You see what I keep saying? This RAHi is going to be an amazing RAHi. Not just from me, but also from our viewers. Kababu Mukonka, again, I also can't wait to see you people at this year's RAHi. Oh, we also can't wait to see you. The other one from Jackson Kelly Ndopu. I hope I read that right. This is very amazing. Watching you from Mongo, and I actually can't wait to attend the RAHi of this year. Thank you so much, Jackson. Mongo is so far from Lusaka, and we are glad that we are able to connect people from all parts of the nation. From Amon Siabonga Ngube, I think that's how that's supposed to be pronounced. Great discussions there. We're following. Thank you so much, Amon, for following through to our great, amazing show. So those were some of the comments that we had from the people, and now I'm going to rush back to Laura. I'm really keeping I'm really keeping in check of what you people are saying, and I think from the conversation that we had, you mentioned that we are going to have a pre-session. Yeah. What? Oh, yeah. So
Oh yeah.
I would love you to just tell the people what we are expecting at that pre-session that you're going to be holding.
Surely, like just hearing, Louis and reading with you the comments, I'm getting even more excited. So just thank you for the organizer for such a wonderful platform, like to gather youth. It's so important. So yes, we're very exciting about this pre-conference, and we really welcome all youth advocates who wants to meaningfully engage in UHC, or to have tool to include UHC into the advocacy plan for other, specific health issue. That you are all most welcome. And during this workshop, participants can expect really to, strengthen common understanding of UHC
Yeah.
and how they can advocate at national and other levels.
Okay.
Get some tools also, concrete tools, concrete toolkits. Especially, for instance, we've created a health for all advocacy toolkit, which give the basics on how to, get involved in UHC, health financing. And this year, as you know, there will be a lot of election coming up across the world. I think 70 countries will be in election period or has been already. So we also have some tools to be involved in election. And yes, I think also what you can expect is, not being only here for one moment,
Yeah.
even if this is a great moment, but you can also become a UHC champions in the long term and strengthen our partnership. Yes,
Yeah.
the role here is very to strengthen civil society voices, make sure that health policy are inclusive and equitable to all, including for young people. And we will love having much more youth voices as we are doing here to
Okay.
join also and empower the movement.
I see myself being so busy that week because I think I'm attending everything. I'm attending everything, the pre-sessions, the Indaba. You guys are just making it sound so amazing. And I know for a fact that it's going to be as good as it sounds right now. So I'm going to attend it all. And still on Laura, looking at the fact that the RAHi is something that's organized mostly for adolescents. What specific aspects of adolescents' health does the universal health coverage will it be focusing on during that time? What area of it are you guys going to be focusing on?
That's a good question. Thanks again, Malongo. Because
Okay.
yes, this session will not focusing especially on one health issue, but
Mm-hmm.
will really like highlight the importance for young people to act, as we are often left behind, not well
Yeah.
heard. So it's very about like giving key tools and to build capacity, inspire, mobilize youth to incorporate UHC in the advocacy plan. And
Yeah.
also, which is really relevant to the theme, is that UHC is about accessing health for everyone. And we're not only talking about accessing healthcare when you have a health issue, but it's also a lot about prevention,
Yeah.
to be informed of what exists, to be informed of what to do, to be informed of the different checkup you have to do regularly. So it will be really focusing about, key evidence-based
Yeah.
speeches to incorporate new advocacy plan, to act concretely, and to attract the attention of member of parliaments, minister of health, and make
Yeah.
things moving.
Okay, okay, that's very good. That's very amazing. I'm so happy about what the universal health coverage is doing and just how you guys are extending all your works all over the globe, across the globe. You know, I actually do follow you, and I do try to get information here and there. So I do see some of the things that you people do. You are across the globe, and that's just so amazing. I'm going to read a few more comments for now. It's Nelly Lopez. Laura, since I'm from Chingola, is this organization also here so that I can be part of the organization? Laura, that question is for you.
Oh, thank you for this question. I don't think so yet, so we will be very pleased to welcome you. Maybe I can put a link in the comments for people to join and become member of
Yeah.
CSEM to follow information. That would be great to have you on board.
Okay, I think that would be amazing because I know so many people are interested. So many people are interested. We have one from Brian Wene. How I wish I can book myself a ticket for this year's RAHi. So much in stock for us, the young people. Brian, as long as you did, um, as long as you did apply, you have a very high chance of being part of this RAHi. So don't lose hope. We are still pushing. We want to make sure we incorporate everybody that we can. One from Vincent, the RAHi, it helps young people to interact and network. True, true. We actually heard this from Louis. She mentioned just how she was able to network and interact with so many people. So I'm glad that other people are thinking the way that you are thinking, Louis. We're going to have another one from Grace. Following, what a wonderful session. Thank you so much, Grace, for following us as we continue to talk about the RAHi 2020. Oh, Louis, I'm coming back to you now. because we are looking at adolescents, we are dealing with adolescents, and definitely adolescents, we don't like to be bored. So what activities or initiatives are we expecting from your organizations at this year's RAHi? Is there anything interesting for us?
Yes, we do have something interesting. And
Yeah,
just like Laura, they are organizing a pre conference on UHC. FHI
yeah,
360 will be um, having a pre conference around the revision of the age of consent for health. As we are all aware, the issue of age of consent for adolescent health services is a very important issue that has to be addressed. So, as FHI 360, in collaboration with advocates, we are planning to have a pre conference on the age of access for health services for adolescents. And the aim of this pre conference is just to provide a platform where all relevant stakeholders, including government ministries, that's the Ministry of Justice, Ministry of Health, Ministry of Education, implementing partners, various civil society organizations, the private sector, the traditional leaders, the religious leaders, as well as we, the young people ourselves, can just share perspectives and experiences, as well as foster a comprehensive discussion around the legal, the health, and the social implications of the current age of consent that we have in Zambia, the current laws that are providing guidance on the age of consent. And we also just want to explore pathways for policy review for better services that provide better and address needs for adolescent and young people. And during this pre conference, one of the things that we're going to do is just review the current legal age of consent for health. I think most people are aware. Our governing document right now is the Children's Code Act of 2022, which
yeah,
states that a child, by definition, is anyone 18 years and below. So, meaning that the age of consent is at 18. So, we just
yeah,
want to review this law and also just bridge the gap between the legal and also the health and cultural perspectives. Because when you go to the health sector, you find that there's a lot of numbers around teenage pregnancy. There's high rates of teenage pregnancy. There's high rates of STIs and HIV infections amongst adolescents and young people. And
yeah,
in most cases, parents will not consent for their child to go and access HIV prevention services or contraceptives.
yeah,
So we are working towards having this law revised or having the age of consent revised, and also just look at the work that has been done, because we don't want to reinvent the wheels. We are
yeah,
aware that there's already organizations that have done background work on this. So we'll be working in collaboration with other organizations that have already started this process, inclusive of the Ministry of Health, and also look at other opportunities that can foster pushing this agenda forward. So we do have opportunities through the Health Services Bill, and just looking at how we can work in partnership with the Ministry of Health to
yeah,
push for this agenda, even through that opportunity, and also
yeah,
work with other organizations like HIVOS, who have done a contextual analysis. They've done consultations with young people on the age of consent, and also
yeah,
other international organizations that are working towards safeguarding the rights and protecting the children's rights and ensuring that the needs of adolescents and young people are being met. And from this, we hope to develop a position paper or a position statement, and later develop a plan on how we can move forward with this. So the position statement that's going to be developed from the pre-conference is going to be presented at the Regional Adolescent Health Indaba. And
wow,
during the pre-conference, yes, we are also going to hear from the adolescents themselves. What is it that they want? Because
yeah,
most of the times you find that, we are putting in place, guidance documents, we are putting in place programs that are meant for adolescents without adolescents themselves being present in the room. So we want adolescents to be present in the room as well, and also just give perspectives. We want to hear their voices on this and just hear what is it exactly that they want, and how should this look like for them. And once this position paper is in place and it's presented at the RAHi, hopefully the Minister of Education can action it, or
Yeah.
just provide buy-in into this agenda, because there is already statistics, there is
Yeah.
already evidence backing up the fact that we really need the age of consent to be revised. So this position statement will be developed collaboratively with the different stakeholders that are going to be present, inclusive of young people. So the young people are going to take lead in developing this position statement, and the young people will present this statement at the Regional Adolescent Health Indaba. So that's one thing that people can look out for, and it's also part of our support towards the RAHi 2024. Yeah, thank you.
Wow. Amazing. This is a very good time to be a young person. I know some people who are not adolescents right now are so jealous and saying, wow, these kids are doing the most and they're going to actually enjoy this time. So I'm proud to be an adolescent at this time. Having amazing information from you ladies is so inspiring and so amazing. Right about now, I think at the beginning of the show, someone mid show, I promised people that we were going to have some giveaways, and I don't bring my promises. So let's get the drums rolling. Yeah, so I am going to ask a question, and the first two people to comment with correct answers are going to be our winners. These two people are going to win a t-shirt, a TYP t-shirt, and 50 kwacha worth airtime. So let's get it. I hope everybody has their mics on, their earphones on, and should hear this question. So the question is, are you guys ready? Okay, so I'm going to ask, what have you viewers learned about the UHC 2030 and the FHI 360 today? I'll read that again. What have you, the viewers, learned about the UHC 2030 and the FHI 360 today? So I'm going to give you just a few minutes as I speak to my guest one last time while you guys are typing that, and then I'm going to pick two lucky winners, definitely the two first people who are going to answer this correctly. So I'll start with Laura. Laura, can you just your last closing remarks? I'll just love you to tell us what the RAHi 2024 has to offer to the people, what your organization has to offer briefly, just what you think about this whole thing that TYP has arranged for the adolescents.
Thanks, Malungo. Well, first the question. I feel it's so hard to respond to that. So many information were given, so don't be shy. Try and put something that is on your mind. That's amazing. I would have been struggling in answering that too. so, so that's amazing. Yes, to conclude on that. Well, this is an amazing opportunity to be part of a huge health movement. I think definitely participate on RAHi. And as a civil society engagement for UHC and wanting to raise civil society voices in health decision-making processes, it's so important for young people to be involved. And we really feel that they're, not included in the conversation enough. We often call out young people at the end of processes just to approve or just to, give their opinion, but at the last stage. And
Yeah.
at the moment, within UHC, we're advocating for resolution on social participation to make sure that everyone, including young people, is included at every step of health decision-making processes.
Yeah.
So I really do feel that's very important. What you were saying also, Louis, like we talk about health, like adolescent and youth health, but often it's not adolescent and young people who speak about it. which is ironic, right? It's like talking about women's rights and having only men speaking about it. so so I will just conclude saying it's important to engage. You don't need to know everything about the subject of the matter. Just showing up, being engaged, trying is so important. So yes, feel free to join CSEM. It's more than 1,500 members, over 130 countries from over 1,000 organizations. So
Yeah.
yes, we can't wait to meet you also in person at RAHi.
Amazing, amazing. Thank you so much, Laura. Louis, we are coming to you with the same question. What do you have for our amazing viewers in regards to the RAHi 2024?
Okay. Well, I feel like this question is like a lot for me. And this is
Just
because
give us loads. That's what we want to hear. Just give us the loads.
yeah, there's just so much to look out for, and there's just so much that I too am looking out for. So, just to sum it up, I think I am looking out to interact with the young people. When you see me, please just feel free to patronize me. Ask me any question around HIV prevention, any question around CAB, just ask me any question around meaningful youth engagement, opportunities for young people to be engaged, because there's so many opportunities.
Yeah.
Sometimes as young people, we think, for us to be engaged, we have to be at a certain level. But then meaningful youth engagement starts even in our communities. We can get involved even in our communities. So I think you can visit our exhibition booth at the RAHi 2024 and just come and learn more about meaningful youth engagement, because we have done a lot of work around that. And as Mosaic, one of our core mandates is to ensure that young people are meaningfully engaged. And that's why even in the technical working groups, that's the adolescent, the SBC, and the other technical working groups, the prep task force, we have ensured young people's participation in those
Yeah.
TWs. So you can come and learn more on how you can get involved. You can come and get materials on HIV prevention methods. Come learn more about oral prep. Come learn more about choice. I think one thing that people keep mixing is the issue of choice and the options.
Yeah.
And by virtue of us now having, a variety of options, most people think, that automatically translates into choice. But then there's a thin line between choice and options. So people can look out to learning more about choice and options, and how options facilitate choice. So we will have some materials on our table, on our exhibition booth. We'll have some brochures, some fact sheets, as well as some goodie bags that we'll be giving away. So people
Okay.
can that, visit our booths. Please come learn more about FHI 360 and also other projects that we are implementing, because it's not just the Mosaic project, but then we also have other projects that we are implementing. So you can come and learn more and just interact. Ask me questions. How have I managed as a young person? You
Yeah.
know, how can we engage with policymakers? How can we engage even in our communities as young people? Yeah, otherwise, I'm looking forward to meeting everyone and again interacting, networking, looking forward to learning more on UHC, Laura. And yeah, I hope to attend your pre-conference as well, just to enhance my knowledge on UHC. Thank you.
Okay. That's amazing. Can I tell you something I'm going to do right now? I'm going to have a very loud speaker and the microphone and spread this amazing gospel to the students at my school about what your two organizations are doing. Trust me, if you find so many people reaching out, don't even be tired, because the medical students here, they're definitely going to reach out. I'm just going to spread it, because what you guys have taught me on a personal level and what you have taught our viewers out there is something so amazing, and it's something that any youth would be willing to actually know about. Thank you so much, guys. So,
Amazing.
so now, our winners. Should we roll those drums again? So we are up for it. So what's going to happen is we are going to read out the two amazing comments, the two first comments as I promised, and these people are gonna walk away with a TYP t-shirt and 50 quarter worth of airtime. Should we start now? Are our viewers ready? Louis, Laura, how are you feeling about the people right now?
I
I'm
feel they've
excited
been
in
like
their
amazing
behalf.
comments.
Okay, so our first winner is it's Nelly Lopez Kabombeka. And her comment reads, have learned that UHC 2030 is trying to distribute services and working with the government and total participation in health matters. UHC, is that true?
It is for the government and social participation, and we
Oh, wow.
advocate for the distribution of health services, but we don't do it ourselves, or otherwise you will have like nothing. We only like a few, number of people.
Okay, so that was our first lucky winner is Nelly Lopez. Congratulations. Our second lucky winner is Brian Moine. There are organizations that are there for the youths to help adolescents in the issues affecting their health. One of the most important issues is that both organizations want youths to take part in decision making. Yeah, both organizations want youths to take part in decision making. Social participation is also one of them. The issue of age is a concern is also one of the issues. Lastly, the organizations are supporting youth in many ways and they are showing their support in being part of the RAHi 2024. Can I give this person a 1,000 personal pocket? I'm just kidding. I'm just kidding. But that was a very amazing submission. Brian, you also won yourself a TYP t-shirt and 50 kwacha worth airtime. So our amazing lucky winners, we will reach out to you as TYP and just tell you how you're going to make arrangements on how you're going to receive your amazing giveaways from us. Thank you so much, guys, for this amazing conversation we just had here. Louis, Laura, as TYP, we are so happy to have you guys on the show and have you guys just give us insight of the amazing things that you do. Thank you so, so much.
Thank you so much for having us.
Okay, so
Thank you.
we've come to the end of the program. Thank you to everybody who tuned in to the Real Talk right here at TYP as we continue to discuss the road to the Regional Adolescent Health Indaba. Everybody is welcome to join in every Friday. Thank you so much. Have a lovely afternoon. Bye.
Thank you so much again. Take care, everyone, and see you soon.